ladies and gentlemen. This is John Mortimer coming here from my office at Millennium Running. And for all you guys that are tuning in, and we have a number of you guys on our Zoom right now that's being recorded for future viewing for all those that aren't able to jump on at 2:30 on a Wednesday afternoon. It seems like so many of you guys are working from home and killing two birds. We won't report it to your bosses that you guys are, I guess, cheating on your real work with us. So welcome to Crushing It. Apple Therapy. Karin Biskovich is a good friend of mine. She's one of the owners of Apple Therapy and one of, well, I would say the best trainer. Don't tell her husband this because he's also a physical therapist, but the best trainer, physical therapist, sports medicine expertise here in New Hampshire. And we're lucky to have Apple as a huge partner of Millennium Running. And so Karin, I want to introduce Karin Biskovich. Karin, unmute yourself and come on.
I did.
Forward.
Okay.
There you go.
Thank you for the intro, John. I'm happy to help. I've heard a few questions. I see a chat question there. So it's kind of fun. It's fun to offer up my services for these sort of Ask a PT. I've been doing this a long time. Been doing it for 18 years. Been an athlete myself for 43 years. I started gymnastics when I was 3. So it's been a long time that I've been out there dealing with injuries, and I just sort of love helping people get back to their sport and continue with athletics in whatever way they can. So it's my passion.
Well,
Yeah.
if I can jump in there, Karin, real quick, I don't think that math adds up. 43 and you were 3 and you're 29. So I don't know how that works, but for those of you that Karin's too humble, she's a national class, world class triathlete as well. So she's competed all over the world in triathlons. So what I like about Apple and Karin is going back to my old days of running and having a trainer in high school or college, and you'd come in and say, this hurts. They'd just say, oh, ice it, because they're dealing with the football players and the players that, basketball players, where in this case, like, no, I want to run. You don't understand. I'm still running. I'm still going to run. And you're telling me I have to take 2 weeks off? You don't know what this does to me emotionally, physically. And Karin and her husband, Ben, what I appreciate about your approach is it's not just about like, hey, you can't run. It's how do we get you to run safely? How do we mitigate these issues that you might have? So with that, Karin, you have been an athlete for decades. And I think I correctly kind of prefaced your approach, right?
Yeah. I mean, I've barely taken a break from athletics because I know how important it is for just like your mental state, just to keep going. And I don't like it when a patient comes in and they say they went to their doctor and they said they want to run. Their doctor says, no, you're too old. That drives me crazy. Nobody's too old to run. And so it's just a matter of knowing how to get started with it and not to give up on that. So that's what I want to help people with. And I don't want them to have to stop moving to get better. You can still keep moving. So.
And I know a lot of us have goals. A lot of us have goals in terms of signing up for a race. It might be a half marathon. It might be a marathon in some cases. It might be your first 5K. It might be a virtual race now because that's all we can really do. But we have these goals and oftentimes, you're what do they call that? You bite off more than you can chew sometimes a little bit, or it seems like it's lofty and you start going 0 to 60. My wife has put together a Tuesday tips, and one of them was too much, too soon, too fast. In this day and age where we're all sort of quarantined a little bit, you have a little bit extra time now. You start running more. Too much, too soon, too fast, right?
Yeah.
And even though, I'm wearing my Antarctica marathon thing because, I bit off a little bit more than I could chew. I got that opportunity to be gifted that trip. And of course I had to start training more. I haven't run a marathon in a long time. And what happened? I was seeing Karin for Achilles issues pretty soon. So she helped me get to the finish line. at a marathon that I had never thought I would ever run again. And so with that, Karin, we did have a couple questions, and I want to be open forum a little bit to people. And we already have, Holly Blanchard, former Miss New Hampshire, by the way, for any of these going to Holly, has a couple questions on there, and Marissa has a question. So I guess we had a couple come in a little bit earlier. And the thing I like that you just said, Michelle asked this question when we first started, was aging runners. And you led with that too. So let's get into aging runners. What can we talk about there in terms of philosophy to keep them healthy?
All right. Well, I have a few things that I think are pretty essential for aging runners. Okay. One is strength. You can't keep pounding on the joints without working on your strength. So it's great to just keep running, but if you lose quad strength, hold on, I'm going to enter into my clinic. Hold on. So, just to show that my clinic is open and running during the quarantines. So, and I can use my equipment if I need to. But so you got to incorporate strength workouts into that, which is good because you guys just had met Orange Theory, right?
That's right. Yeah, Orange Theory on Tuesdays, and then my wife Jen has been leading stuff with our club, just 15-minute core routines.
Yeah.
Through the Running Club Facebook page on a Zoom as well. So those little core routines, and it doesn't have to be like a 2-hour-long workout of core. No, we're talking about little things, right?
Little things, just making sure that you're not. I think people get caught up in their run workouts and they forget about the strength part. And if you start to lose some muscle mass in those, running is good for strength, but it's not the same as building strength for strength training and core workouts. So you got to keep that up, and also just flexibility too, because as we get a little stiffer as we get older. And so if it's really easy to finish a run and be like, oh, I don't have time to get my stretch in and I got to get to the shower and get to work. And so those are those key moments to get your stretches in, is at the end of a run or end of a workout when you're really warm is when you should be doing your static stretching. You actually don't need to do a ton of static stretching. It's really when you're warm after that run, maybe like one rep of 30 seconds, a little bit longer for a little older, like over 60, you should probably hold it for a minute. But just all you have to do is one rep to maintain that mobility, but it's got to be when you're warm. Okay. And so more importantly is that dynamic warm up before you start your runs, which I'm sure with the Millennium workouts, I'm sure you guys have been doing some dynamic warm ups before you do your stuff, right?
Sure. So I think, of course. I mean, I think well, you were so right about that. I had the opportunity to interview Chris Carpenter in one of our speaker series, Cy Young Award winner pitcher, who lives down the street from me now, and he can't play baseball and was retired, but he's going for runs in the neighborhood. And he was telling me how much his calves hurt and like they never warm up. And, as a warm up, as a pitcher, he would spend 90 minutes going through a warm up to get ready to throw, in the World Series.
Yeah.
And running, he would just put on his shoes, walk into his driveway and start jogging.
Mm-hmm.
It doesn't work that way. And I was like, Chris, come on, man, you're so good.
Yeah.
You got to warm up. And I think that goes for whether you're a Cy Young Award winner pitcher or a 65-year-old woman on the call or a 29-year-old PT like yourself. So
and I have to say, I since I became a PT and learned about dynamic warm up, I have not one single time have I ever just gone out for a run without warming up, because all it does is set you up for injury. And it's just, I only do it for about 2 minutes, 3 minutes sometimes, but that's all it takes is just to get that. You have to kind of lengthen those muscles to get that blood flowing, get your Golgi tendons going, and then your muscles will be much more primed and ready. So.
Well, when we talk about dynamic warm-up, for those that are part of the running club or have seen the Millennium warm-up, dynamic warm-up, not just sitting there stretching, not just holding something. We're talking about utilizing your muscles for range of motion to get blood flow, right? Like you have an agonist and an antagonist muscle, so you're using one muscle to stretch the other one, right? That's what we're talking about, range of motion. And, I find it really funny when I'm in my driveway and people see me doing crazy things before I'm ready to run, shaking things out, and like, it can be kind of, it looks kind of wonky, or, you know, trying to push a building over. Obviously I'm not going to push the building over. We know that. But doing those things for, again, just 2 minutes, right?
Yep. 2 to 3 minutes. That's all it really takes, to get for a minimum, you know, like if you have time to do 5 minutes, then go through 5 minutes to get more muscles. But I think everybody knows sort of their key issues. So I know the key muscles that I have to address, and I make sure I do those every time. Like I know it's my calves and my hamstrings and my hip flexors. And so I always hit those, you know. So sometimes it's just, some people have more issues in a hamstring or a calf than they do other muscles. So you just get your key parts, right?
Well, that's what Holly Blanchard's asking right there. She recently had a hamstring issue, right? And she might have been one of these ladies that did too much, too soon, too quick. She got into training it, crushing it, and training in progress, doing great on her social media. Good job. And she also happens to work for CHAD, Children's Hospital Dartmouth, which is our official charity for 2020. So I think she's personally and emotionally invested in this, but we want you healthy, Holly. And, you know, that warm up, right? So she's specifically saying she's got a hamstring issue. You know, let's talk about that a little bit. So you can warm up the hamstring, but sometimes the hamstring is where it hurts, but it's not the problem, right?
Right. I mean, sometimes it can be in your piriformis that's sort of pulling on your hamstring, or even your calf can actually cause some hamstring stuff too. It's sort of the whole chain. Yeah. So if it's the hamstring, you got to do a little bit in the hips, a little bit in the calf and the hamstring. Yes.
So it's not just like, hey, my hamstring hurts.
Yeah.
Take care of the hamstring. It's
right.
It's the body chain, right?
Yeah. And I had somebody with a glute issue. All the pain was in the glute, so she was stretching the heck out of her glute. Well, her glute flexibility was great, but the front of her thigh was so tight that it was causing her glute issue. So she had to be stretching the other side, and she wasn't stretching that side because that wasn't where her pain was.
Right.
So sometimes you got to think about both sides of where the injury is and the other side too. Yeah.
And so, you know, the warm up for those things, we talk about like warming up, you know, you said just a minute or 2 or 3 or 5, the more the better, right?
The more the better. Yes.
But when we talk about warming up for things as a physical therapist, we're talking about we're not talking about, you know, getting this huge sweat going on. We're just talking about range of motion,
right?
Getting your body, like every single muscle group ready to go, right?
Yep. It really is. It's sort of range of motion, blood flow and like range of motion of the muscles before you start to tax them. Yes.
Mm-hmm. For sure.
So.
And then, you know, when you start most of us will just do a casual, you know, a training run or walk to start.
Yeah.
Sort of the same way, easing it. You're not like, it's not like the firing gun goes off and you start sprinting when you start one of your workouts, right?
Right.
If it's a distance, if it's just a recovery distance day, call it a distance run, or walk, you're starting slower and crescending into it, right?
Yep. Even on race day and training day. I mean, you should always start slower too.
Yeah. Well, and like when we talk about the warm up, and you know, depends on who's on the call, right? So you might give some training advice or some physical therapy advice to, you know, an elite level athlete that's trying to break 4 minutes for the mile. Well, you're not going to start really slow.
Not super slow, no. Yeah.
Not super slow, but so it's all relative. But if you are trying to get optimal performances, like, hey, I'm gearing up for my 5K, or this weekend is as part of Crushing It, we're starting with a baseline mile. So it's a 1 mile event on the weekend. We're using that as a training tool. This is your baseline mile. And as we progress through that, you know, if you want to have a more optimal performance, part of your warm up is not just the range of motion and just go do a 1 mile. It might be do your slow warm up, and then you jog for 10 minutes or walk for 10 minutes. Like you're actually progressing into your warm up before your optimal performance too, right?
Yes. Yeah. And I would recommend doing a dynamic warm up and then an easier kind of warm up jog. And then you can even do a few sort of dynamic warm-ups incorporated in your jog, like some high knees or some butt kicks, or like that are incorporated in your jog to get a little more sort of pep in those muscles. And then you can start accelerating your pace a little bit, you know. I think as we age, the more important all those steps are in the process. Yes.
Right.
Yeah.
And then for those aging runners out there, right? You mentioned one thing, the little things, right? The little things. And I had an expression when I was a college coach for 10 years with my athletes, my collegiate athletes, the little things made the biggest differences.
Mm-hmm. Yeah.
So it's not just one thing, it's a whole bunch of little things. If you do right, ultimately keep you healthy, right?
Yeah. And like, so looking at one of the other chat was like, I broke my foot a few years ago and sometimes it still hurts when I run. So some of the little things and with the foot is balance work. Like we don't often think about doing balance work as a little thing to keep up with the running, but that actually is really important because it works those little muscles in the foot that we pound on over and over and over again with running. So I recommend balance work a little bit, but on a consistent basis. So without your shoe on. Yes.
Well, you bring up a good point on that in terms of balance work. And Marissa, and I recall her breaking her foot on the cross country course at Dairyfield Park, and heartbreaking for me to see anybody run one of our races and get hurt. And you know, the idea of recovery from an injury, and I've had a couple knee surgeries, and there's times where I don't feel like I'm 100% for a while.
Yeah.
After that. And that was with really good PT, like twice a day, 7 days a week PT. And my situation was a college environment, so I could be with our physical therapist every day, twice a day. A lot of the stuff you're talking about right now, you did finish the race. I know, Marissa, geez, of course you did. It takes more to bring you back than that. But it's about, I guess, doing it consistently. And if you have a PT appointment, maybe, twice a week, 3 days a week, but you could be doing this stuff every day, right?
Yeah. 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 It's not often when you have PT exercises, those little exercises, you can't usually overdo those by doing them. Like, strength training, if you can overwork it. But these little muscles, you do a little bit every day, you're never going to overwork it. You're keeping them primed and ready, So that's why I like that little core workout that Jen is doing. You're just keeping those core muscles primed and ready to always be activated and working while you're running, which is important.
And I think you bring up a good point. It's not like you're throwing around, you're not getting barbells and throwing them up over your head. These are all intrinsic little body weight movements. You don't even realize how weak you are.
Yeah.
I know you've treated Jennifer quite a bit, got her to her first 2 marathon finish lines.
Yeah.
And, between dry needling and core like a whole bunch of range of treatments in order to get her to the finish line, which was amazing. But she would come home and say, Karin gave me this new exercise, and it would be on her side with the other hip going up, other leg going up. And she's like, I can't do it on this side. And this is a girl that can, run super fast, but she can't do one exercise because her body's not her intrinsic core strength is just missing for that one thing.
Yeah. And you got to get the whole thing to work. Yep.
Yeah.
Yeah.
So I know we had a couple other questions that came up as well, that, we could talk about in terms of, I think in the future, we're going to demonstrate some of these things and do some at-home core strength exercises to help things. But there's some pretty common injuries that runners are going to see. I've had them. Treatment for these sort of things. One of them was, the plantar fasciitis.
Mm-hmm.
That, I think, if I could have people raise their hand, probably half of you guys have had plantar fasciitis before, right?
Yeah.
Talk a little bit about what that is, and then how we go about mitigating it.
Yeah. So, plantar fasciitis is basically like the plantar fascia is this band of connective tissue that attaches from the ball of your foot, and then it's wide, and then it comes in narrow and comes in and attaches right in that calcaneus in the heel. The fasciitis is basically inflammation of that fascia, right? It typically is most often right at the insertion in the heel, and I think it's another thing that over time that fascia becomes a little stiffer, less flexible. And so things that usually tend to trigger these things are changes in shoe wear, spending a day in bad shoe wear, overdoing it, amping up your mileage or running too fast, and sometimes you don't even know it's happening until it's like 3 months in. Like you change some shoes, 3 months later, all of a sudden you're starting this plantar fasciitis and you don't know why. And it was actually this pair of shoes you started wearing 3 months ago that were too small or not quite supportive, or, and unfortunately it's like hard to go back and change that, but it's just something to think about when you change some shoes or buy shoes that are too small or just don't fit right or don't have good support. Sometimes down the line, those can cause that plantar fasciitis to get started again.
To jump on that a little bit too, it's starting to get a little bit warmer, right? Spring is coming, right?
You're flip-flops, aren't you?
Flip-flops, right? I totally am. And I see this when people go to Florida for like February vacation.
Yeah.
And you probably see in your clinic, like April vacation, February vacation with the kids. They go to Disney, and we've been walking around in winter boots and highly supported shoes we've been running on. And then you go and wear, poor women have, you guys have too much fashion. Fashion
Mm-hmm.
rarely comes with good support, right?
Right.
So talk about flip-flops.
Yeah, flip-flops. They're tough. If you don't have good flexibility in those intrinsic muscles in your foot, and if you think about how the flexibility of your big toe, because your big toe joint needs a lot of flexibility with running, the way you flex through your big toe. And if you don't have flexibility in that joint, and then you put a pair of flip-flops on, you're like every single step you take where you lift that, you have to kind of lift your toes up a little bit to keep your flip-flop on. You are sort of stretching through that plantar fascia and putting tension and stress on the insertion. So that's why flip-flops are so bad, is the way you have to extend your toes every time you take a step and lift the top of your foot up to keep the flip-flop on.
It is tough. So when you go from like not wearing flip-flops for 9 months or 10 months to all of a sudden in flip-flops every day, that's too much too soon.
It's basically a repetitive strain injury on your plantar fascia. Right. If you think about repetitive strain injuries on other body parts that people have repetitive work injuries, it's like the same concept, right? So and it happens gradually over time, right?
And then that also goes to, again, women in fashion, not all flip-flops, some of them are it's like a cardboard with little strappies on them. They're literally nothing to them.
Yeah.
Other than we sell some UFOs in our store, the gushy ones, and they have a lot more support to them. I'd recommend something like that rather than the flat Toms flip-flops that are, next to nothing to them.
Yeah.
So that is certainly too much too soon overuse injury that happens pretty quickly.
That is so. One thing I would recommend people work on to prevent plantar fasciitis is to work on that mobility through their great toe. So doing one of those stretches where you kind of put your toes up against the wall, so you're stretching through your toes and your heels on the ground. Just like you got to keep that mobility up. If your big toe starts getting stiff, that puts a lot of repetitive strain on that plantar fascia insertion, and that's where things can get started.
For sure. And I think that was one of our goals in these future sessions. This was more an introductory session for you guys to get to know Karin a little bit. But, as we get more into it, and again, we're going to always take these questions from people about, what might be bothering them, and we can talk about that in real time. But we're going to kind of dive into plantar fasciitis pretty deep, IT band syndrome, stuff that runners get quite often, shin splints. People hear about shin splints. They come in our store all the time saying, "Oh, I got shin splints." Well, why? And how can we fix it? What can we do at home to do this? But, these are hard problems to fix. And Karin is amazing. She's not a miracle worker. And part of it is because it takes two. It takes you and the runner to do your part as well. She can't fix it unless you do your part as well. And we did have another question though, and I think this is a general one. Well, it's specific, but it's general because you can talk about it in terms of motivation and some good philosophies. But was it who was on the line that said, talk about running after having a total knee replacement? And that's a hard one, right? Because I know you don't want to have the message you cannot do it.
Right. Well, it is definitely one of those, you have to have a conversation with your surgeon. And it has to be, about how comfortable the surgeon can feel with you doing some running. It's not like you can't, I think nowadays the replacements have gotten so much better that it's not like you can't run, but you can't run a ton. Like, it's like you gotta be careful about how much you have to really work on the cross training aspect so that you can do the running on a total knee. But because the components are so much better, they last so much longer. They used to say absolutely not because it's too much wear and tear on the components, but now they've gotten better. So now they don't say absolutely not, but I think it's very individual to the person and the surgeon, and also the person's motivation to do cross training and not do too much plain running on the joint.
So. And as to add on to that a little bit in terms of having an injury, it's like the knee is an issue, but when we talked about strengthening and everything else has to get stronger too, right?
Yes. Yeah. So if the surgeon okayed it, then I say you go for it, but you definitely have to keep up. The strength is pretty critical for how you're putting the strain on the ligaments and tendons around the knee, right? So you might have some pain in the patellar tendon in the front of the knee. So which mean you have a little bit more, you need more strength in your quad and your hamstring to offset that. Yeah.
Yeah, and Marissa, you've had more than your fair share of things. She had a total knee replacement back in 2010, and a year and a half later.
Yeah, and I think that's probably it usually takes 1 to 2 years for the full healing to happen. So if you do it too soon, then you kind of risk that sort of some inflammation and some issues coming up. So a year and a half is probably a good timeline.
Mm-hmm.
Yeah.
And in that year and a half, sort of like during this time of COVID-19 quarantine, take that time to work on the other things too, right?
Yes.
So
work on the strengthening. Big part is the strengthening. Yeah.
But it's not just, you have your knee, obviously you have your knee capsule, you have your hamstring, your quad, your calf, all the surrounding ligaments and joint around the joint, but you also have your core strength for the rest of your body too. This is the time to work on to get that 6-pack.
Right. Well, it all starts in the core.
It all starts in the core.
It all starts in the core.
Right. Yeah.
We talk about that. It's like proximal to distal. So if you don't have strength in your proximal region, which is your center, your base, then even distally, you're going to have injuries because something has to always take the brunt for some weakness. So
for sure. And we want to get to one last question here, unless people put them in the chat too, because we said it'd be 30 minutes and you got to get back to patients and homeschooling, Karin. I know that. Talking about Nora asked about her
angry perineals.
Yeah. Talk about what is that?
Well, so that's the muscle that lines the side of your calf. So sometimes people get tendonitis in their perineals, and it can be kind of a form of shin splints. So shin splints is a very broad term. It can be the front, it can be the side, it can be the inside. I think with the perineals, there's 3 things that you can do. You can do, so usually I say more to work on some foam rolling because they're hard muscles to stretch. You can't really stretch those muscles. If they're really that angry, you got to ice consistently. And I am a big fan of that sort of kinesio taping, so if you do some taping, you can support those perineals while you're running, and you got to always consider your shoes and make sure you have good supportive, inserts in there to help if the perineals are bothering you. Yeah.
I don't know if it's the perineal or not. I've often had, when I've been running, I'll twist my ankle slightly, step on a rock off the edge of the curb, and it's like, oh, I kind of got it. And then 2 days later, the outside of my, is that the perineal?
That's
all the
the
way
perineal,
up?
yeah.
It's like, man, that hurts. And I forgot that I actually did it 2 days prior. And it just takes time to foam roll it out or get it worked out, right? So that's sometimes you don't even realize you did it or what did it, right?
Yeah. So if it's so Nora says it tends to cramp after a mile. So sometimes that just means you need a little more dynamic warm up. It's hard to necessarily dynamic warm up your perineals because they're more stabilizers, but you can just sort of twist your ankle in and out for 30 reps to get that dynamic warm up blood flow in there so that hopefully they cramp a little bit less. But you got to kind of find a way to sort of get those muscles warmed up again, dynamically before you start running.
Mm-hmm.
And that might help with the cramping a little.
And what about some of those things like for the perineals? Like I've always, even my son who is playing football and twisted his ankle, having just do the ABCs with your toes, right? Like
yeah, I mean,
sitting
that's
there
another
watching
way.
TV, doing the
Yeah.
ABCs.
Yeah. Yeah, that definitely will get some blood flowing. If you feel like the muscles are getting warm and burning a little bit, that means you've gotten your dynamic warm up in there. Like should feel like almost a little bit of burn in those muscles to say that I'm warmed up. Yeah.
Well, Karin, we're at our 3 o'clock. So thank you for the 30-minute telemed, whatever we're going to call this, Apple therapy. Appreciate it. You guys are going to know Karin a little bit. She's super approachable, easy to talk to, super knowledgeable. And we're going to do this every week, same time, same station, record it, put it back out there as a reference for you guys. So come back on next week and we'll do it. If you have any questions, you can always email them to us ahead of time and I can bring them up. So on all the communication that goes out, feel free to email back about some questions you might have. We'll be happy to talk about it. And we're going to get into some of those common injuries over the course of time and even foam rolling techniques and all sorts of fun stuff that will help you stay healthy and injury free as much as possible so we can all be happy and healthy. So Karin, from Apple Therapy, thank you very much. Keep treating all those people. And I know you're open. So if anybody has anything that they need to make an appointment, just call the main number at Apple Therapy. And you have how many locations do you have?
We have 6.
6 locations.
Bedford, Amherst, Londonderry, Manchester, Executive, and Nashua. Yep.
Awesome. Well, thank you very much. And
thank you guys. Great questions for the first day. And hopefully we'll get to more specifics too.